We're going to give another minute or so for people to come in. You probably just got a little notice that says we're recording the session, so go ahead and push the got it button so that you can accept that. My name's Amy Hess. I'm here at Nationwide Children's Hospital. This is Family Echo. We're going to talk about family supports today, and we are excited to have a lot of people join us. I hope your 2022 is going well. All right, I've got some. I'm just going to give it another minute to see if we can get some people in. You probably were looking at some of the slides if you're in the waiting room, and we're going to go through those again before the session starts. So if you missed anything, don't worry about it. But we'll talk about today's session and then the next sessions that we have coming up. So we have sessions planned through March at this point. So we're excited to tell you about those and hope you can join us for those as well. All right. All right, it looks like we have more people coming in, which is good. I know we had several hundred people that were registered today, so I want to make sure that they can all get in. So we'll do like maybe a bit of a slow opening so we can make sure everybody gets to hear the material. Number's still going up there, which is good. All right, let's go ahead and we're going to get started. It's a minute after, so we'll go ahead and Laura, if you want to take me to the next slide, that would be great. So again, welcome everyone. If you're just joining, my name is Amy Hess. I'm here at Nationwide Children's Hospital, and you have joined Family Echo Autism, which is great. We have a really large group of people that like to attend these sessions, and we're so happy you're all here. So as we do introductions today, if I call out your state, if you're from Alaska, give us a wave, those kinds of things. We always encourage you to chat in questions and unmute if you have the opportunity, depending on how the session goes today. But we always just want to caution you to not use protected health information. Again, that's any identifying information to you or your child, so such as name or a school system or the city you live in, those kinds of things. You want to keep that. We want to have you keep that as protected as possible. And then we always have poll questions and opportunities for you to sort of give us suggestions for how things you'd like to see in the series. So you'll see the poll questions today in the session, and then we'll drop a link into the chat. So if you have a suggestion or idea or a topic you'd like us to seriously consider in the series, you'll have the opportunity to do that. Next slide. And then a couple of Zoom features. Again, if you see that red line over the camera or the microphone, that means we cannot hear you, cannot see you. And when that's off, that means we can hear you and can see you. In a large group like this, just remember to try to be muted as much as possible, or at all times if possible, so that we can really have good sound quality for everybody. And then again, use the chat to reach out to us at any time. It's completely fine. All right, next one. You're going to have access to resources today, so we'll send you the information for that, and it'll all come out to you by email. But you'll have access to resources and the recording from today's session, like always. Next slide. And then again, what we do here with Family Echo is we really are part of Project Echo, which is, and we're going to drop a link in here. So if you want to learn more about Project Echo, you can. But it's really about moving knowledge and not patients through a lot of discussion and around cases and around topics of interest and didactics. And we'll always follow the same process that Project Echo has trained us on, which is always do welcomes and introductions and say hello and give you a session overview. And then we're going to get into a case presentation, which Sabrina will be presenting today, and Amanda's going to be facilitating, where we really can start to learn about questions that you should ask from your own perspective, and then think about recommendations that you would make or that you would hope that maybe you could learn from during that discussion. And then we'll also get into more discussion and opportunities for you to ask questions and make suggestions for the session. But then the thing that we hope is that you'll take what you've learned today and apply it, maybe not just to your own family, but maybe go back and ask questions to your providers from things that you've learned today, but to really carry this knowledge on so that it's not just a one session, one moment, but it's really for the next step in learning. Next slide. And then the agenda for today, we're going to do welcomes. Again, we're going to go through the case. We'll have the presentation. We'll do questions and answer sessions, and then we'll get into the poll discussion or the poll questions. Next slide. One thing I will mention is that we do record this and we do collect some data as a part of our partnership with Project Echo. It's all de-identified. So, you know, your state that you're from, those kinds of things will be collected. So Cody, I'm going to go ahead and hand this over to you to start off introductions.
Thanks. Hi, everybody. I'm Cody Hostetler. I'm a psychologist who works in primary care, and it's good to see everybody. Amy?
Amy Newmeyer. I'm a developmental pediatrician here at Nationwide Children's Hospital.
Hi, everyone. I'm Sapna Shetty, couples and family therapist at the Child Development Center of Children's Hospital. It's so great to see all of you, and I'm going to pass it on to Ellen.
Good afternoon, everyone. My name is Ellen Geib. I am a psychologist at Nationwide Children's Hospital. I am also a sibling to 2 individuals with autism. Passing along to Dr. Buder.
Hello, everyone. Thanks, Ellen. My name is Eric Buder. I am a clinical psychologist with a specialty in pediatric psychology and neurodevelopmental conditions like autism. I'm chief of psychology here at Nationwide and just really excited to be here with all of you. Let me pass it off to Lisa.
Hi, everyone. Lisa Nowinski here. I'm a clinical neuropsychologist and the director of our clinical services at the Mass General Hospital Lurie Center for Autism, just outside of Boston. And I'll pass it to Amanda.
Hi, everyone. I'm Amanda Bennett, a developmental behavioral pediatrician at Children's Hospital of Philadelphia and the clinical chair of our Autism Integrated Care program here. And I'll pass it on to Andrew.
Greetings, everyone. So glad you could join us. I'm Andrew Nelson. I direct our autism response team at Autism Speaks, and it's going to be great to interact with you today. Over to you, Amy.
Hi, everyone. Again, Amy Hess. I'm here at Nationwide, and I'm also part of the Autism Care Network and help to chair their Family Partners Group. And I am going to hand it, Josh can't be with us today, so I'm going to hand it over to Sabrina.
Hi, everyone. I'm Sabrina Long. I'm a clinical social worker at Nationwide Children's Hospital Child Development Center. Handing it off to Lindsay, I believe.
Lindsay was not able to make it today. I just heard from her. So I don't know if Angie's on.
We'll grab them when they arrive then. All right. And Andrew, you want to go ahead and start with your team?
Absolutely. So I'm joined today with my coworker, Marinide Planel Camacho, and we will be in the chat. We're from the Autism Response Team at Autism Speaks. We'll be with you today in the chat. If you have questions about local resources in your area, supports, our team can search for those things that you're looking for. So please do use the chat today to ask about specific resources, and Marinide and I will do our best to find those for you. And good news, Marinide is also bilingual, so if you would prefer to communicate in Espanol, she's available for that as well. So have a great session, everyone.
And hi, everyone. I'm Nancy, and I'm here with Melissa and Wara today as part of your ECHO support team. If you've got any questions, please reach out to us through the chat. We're happy to help you.
All right, and so we wanted to take some time to meet all of you. We have participants that are from 40 states here in the United States. So if you're from, you know, let's see, if we have people from California or Georgia or Alaska, give us a wave. We'd like to see you. We had a lot of Georgia participants this time. We always have a lot of Pennsylvania participants. So if you're from Pennsylvania, give us a wave, and we're so happy to see you again. Florida is another one that we've had a lot of participation. And we're really happy to see some folks from Utah and some from Wisconsin as well. So again, give us a wave. If you want to go ahead and change your name to, I'm from Wisconsin or something like that, that would be great to see. So welcome to all of you, and we're so glad you're here again. Next slide. And then we have participants who joined from around the globe. So welcome to those from Argentina, Australia, Canada, and Saudi Arabia and Turkey are new ones. They haven't been with us before, so great to have you here. And those of you from the UK, nice to see you, and congratulations on the Queen and her new Jubilee that she just celebrated. All right, next slide. Angie, I don't know if she was able to join us yet. Angie, are you here?
Oh, yes, I've been on. I'm sorry. I thought you had another Angie. I thought there was 2 Angies on this. I am so sorry.
That's fine. Angie, if you want to introduce yourself real quick and then do the next couple slides about the network, that would be great.
Sure, more than happy to do that. Hi everyone. Welcome to this session. I'm Angie Fidelli, the Director of Operations for Autism Speaks. I work closely what Amy has in her team, supporting the day-to-day operations of the Autism Care Network. We're really excited to be funding this and really having an impact with families. I also work closely with our Autism Response team, who we also have on this call. So hopefully you all will get a lot out of this call, because these sessions have been amazing. So just give me a couple minutes to talk quickly about the Autism Care Network. The Autism Care Network is the first learning health network focused on autism. And our main aim is really to ensure that all individuals with ASD will have optimal health and quality of life. We feel that quality of life is determined by each family, caregiver, patient. It's not our place to determine that. So whatever you define as quality of life, our goal is really to make sure that each individual has an optimal health and quality of life, regardless of where you're located as well. And so some of our short-term goals that we're doing right now in the Learning Health Network, in collaboration with our families and patients, we're focusing on decreasing the percent of children that have moderate, severe, or extremely severe behaviors that are reported by our parents and caregivers. And we're going to do this by focusing on improving identification and treatment of symptoms of ADHD, anxiety, and irritability in autism, as well as I mentioned, increasing the percent of children whose parents report their quality of life to be very good or excellent. So there's some of our short-term goals. We have 20 centers that make up the network. I think you can go to the next slide for that, right? Yes. So we have 20 centers that make up the network today. We're always looking to expand our network, and you can find more information either at autismspeaks.org or on our website, autismcarenetwork.org.
Great, thanks, Angie.
Sure.
And we'll drop those links in, so if you want to find more about the network, it's there, and resources that they offer as well. Again, we always just like to do a really quick overview. We know one of the goals of Family Echo Autism is to really share the medical and behavioral information that we as a hub team have learned over the years, and with working with the Autism Care Network, and to really share that and move it out of our clinic and into your home, so that you can have this information and use it directly with your family, with your loved one, and then share it back with your provider. Laura, you can go to the next slide. One of the things that we say is that you are very important care and treatment team members. Your voice is incredibly valuable. That's equal to, the clinic visits that you do. What you bring in really can help shape, the medical and behavioral pathways that you're, may need, the choices that you need to make with your child. So we really want to increase your learning and your opportunity to really shape the next steps of your healthcare for your child. And again, we always like to say, we really want you to take it back and bring it back into your homes, bring it back to your families, and then, give it back to your healthcare workers, and share what you've learned across your community as well. And then I think I'm going to hand this over to Sabrina, and we are going to get into our case discussion. Sabrina?
Yes, can everyone hear me? Okay, so I am going to be talking about Zeke today. Zeke is a 4-year-old boy who was diagnosed with autism in the fall of 2019. At that time was referred for ABA, special needs preschool, speech, occupational therapy, and feeding therapy. Also around the same time, there were some concerns for seizures followed by neurology, but ended up not being diagnosed with epilepsy, just had one seizure. So fast forward to March 2020. I think everyone remembers what happened then. Family had started ABA during that time, but they had therapists that left, and it was difficult to find new therapists, so they just stopped. They had not applied to preschool previously because the child was getting ABA services. And the only options at that time for speech and feeding were telehealth. Mom didn't think that those would really work for her child, so the referrals ended up being closed out. So now we're in this past January 2022. Mom reaches back out to the clinic asking for help. The child has been home for the last 2 years and is just getting bigger, stronger, and more active. not receiving any services currently, and mom is having trouble getting connected. Main concerns for her are the child's eating, getting him into school, and getting him into therapy.
Thanks, Sabrina. So the way ECHO works is we open up now that Sabrina's given a little bit of background, to ask questions. And this is your chance to type questions into the chat, or you can unmute and ask your question, raise your hand, if you know how to do that in Zoom, and we can identify you and unmute you. So does anybody have any additional questions, things that that they would like to know about this family or about this child that might be able to help guide the advice you would give? So Irma, I see your hand up. If you want to unmute, we'll pull the information back up so you
Hi.
can speak. Yep, go ahead.
Yes. Okay, so I can kind of identify myself with Zeke. My daughter is 3.5, and she got diagnosed with autism in November, and I'm seeking services for her. We're going to start ABA, and preschool was another option. I come to find out that there's no spaces, there's no classrooms available for her. So it was very, very, very disappointing. So I'm looking for other options if you guys can help, because they told me there's no space. There's no space in preschools.
So Irma, I know that the resource folks are going to hear that, and they're going to probably follow up with you individually to give some suggestions for you. There's a couple of questions in the chat.
Okay.
So Julie asks, what self-care skills is the child working on, and what sorts of self-care skills is Zeke already successful with?
So he is toilet trained, which is really good. So able to use the toilet on his own and can feed himself, but is just on a really limited diet, which then has been leading to some constipation.
Great. And then Jean asks, what are the child's behaviors like at home?
He's active. So he is loud. Communication skills are pretty good. I think he is using phrases to communicate, but is just active. And as a side note, they have 4 other children in the home, and they're all currently being homeschooled, doing like virtual school options. So the house itself is just chaotic. Everybody is home all the time.
That's such a great point that you're highlighting. And I actually got a question sent to me in the chat. I'm not sure they want to speak or raise their hand, but I wonder if you could tell us, Sabrina, about the family support systems in home and more broadly. And also, are there any, you mentioned siblings. There are a few siblings, it sounds like.
Yeah, so he is the youngest. I believe, I can't remember if it's of 4 or of 5. So I can't remember if he has 4 siblings or is youngest of 4. But he, and it's mom and dad. They both live together. Mom is not currently working. I believe dad is working outside of the home. They are of African descent, but English speaking. English is their primary language. So that's the only other cultural consideration at this point.
So a couple of other questions that have popped up. Questions about other health issues that the child might have, if there's any other medical things that the family's having to navigate.
Yeah, so he was being evaluated by neurology for a while, kind of right between when pandemic started, because he had 1 seizure, but had an EEG, never had any other seizures that they reported. So was discharged from neurology and was followed by GI for a while for constipation. But again, that was something else that kind of fell off during the pandemic.
And then a couple of questions about resources and supports. So people have asked about social media or online trainings that the family might have looked into for how to manage behaviors in the home.
That is a great question. So mom actually is, she's in a local support group, like a Facebook support group. So she's heard a lot of information from other families. She was actually trying to get him on the DD waiver because she had heard that Medicaid would help, having him on straight Medicaid would help kind of pay for things. And unfortunately, he's not a candidate for the home waiver. So we've talked about just getting connected with the local disability board.
Couple of questions also about things around his daily routine and if the family uses visual supports or other strategies to help him in his day-to-day routine.
So I don't know a whole lot about that. My guess is that it's slightly chaotic, just given how many other children are in the home and also doing school during that time. So I don't believe there's any visuals being used though.
There was a question about sensory needs as well. Does he have any sensory issues or needs?
I mean, besides his feeding issues, that's probably the biggest thing, is that he's really particular about what he will eat and really only eats a handful of foods.
And has the family reached out like to the County Board of Developmental Disabilities? Have they pursued any behavioral or outpatient therapies like speech or OT or PT?
So they are back on, they were recently, after I saw them, I re-referred them to have feeding therapy to help kind of increase his diet. They are not receiving any other therapies at this time, but we did talk about getting him evaluated for preschool so that he can receive those therapies in the classroom.
And then there's a question about what his weight looks like, since you've mentioned that he doesn't eat a lot of foods and you talked about feeding therapy. So are there concerns for weight gain or weight loss?
He's actually a little overweight, so not necessarily weight loss, but weight gain for sure.
And any issues with sleep, Jessica asks.
No.
Okay.
These are great questions, by
Yes,
the way.
you guys are asking really good questions. This is great.
Great.
Are there suggestions? So people have started, this is always, I have trouble with this in ECHOs that I run as well, keeping the questions to questions and not shifting straight to the recommendations. But are there recommendations that people would make for this family? Any resources that you would share? A few people have already sort of made some suggestions around some in-home supports and some behavioral strategies that can work really well. Jessica, I see your hand is up.
This kid don't offer the ABA like online with training for the mom and help his kid of working and the therapy online. And also if she don't apply for waiver, maybe in the list, some services can help, like a respite, because she have other kids and she need time. And also if she put like a schedule for all his kids, because obviously she have a lot of kids in home and is a chaos, and maybe that making a chaos in his older kids and his younger kids, sorry, maybe help his kids feel more comfortable and calm down.
So there's like some really great, those are some really great suggestions. And a couple of those times, those have shot up in the chat as well around the schedule has come up a couple of times, and people have said not just a routine in the schedule for Zeke, but for all of the kids who are at home doing online school. A few people have talked about family connecting the family with providers and seeing if providers can start to work together to support the family. So can they ask their primary care provider or their insurance company, and can therapists co-treat? That's popped up a few times. Online training, I saw that as a question, and then you mentioned that as well. People are talking about Facebook support groups for autism and sensory issues. I'm trying to catch everything. There's so much in the chat, I'm missing things.
These are all great recommendations. And I will say that we have kind of slowly started the process of getting back into services. So I think someone had suggested connecting with their Board of Developmental Disabilities, which we started that process. They started the evaluation process for preschool. And then we are trying to get reconnected with ABA therapy. But I like these suggestions for in the home. I think that would be something that's immediately helpful to the family, which I hadn't really thought about.
And there's lots of plugs for like parent-to-parent support groups and support programs as well.
Yeah, those are all great ideas.
Making sure I'm not missing anything. There were some comments for evaluation for a special education preschool setting for this child. Now that things are starting to maybe open back up again.
Any other suggestions from the hub or anyone else?
So there's a couple of resources people have shared. So I personally give the Due to Learn website as well, and someone put that in the chat, which is a nice resource for building visual schedules. And the visual schedule has come up a lot. People have talked about recreational supports that might be good for the child. Also, some reminders for self-care for the family.
I agree.
These are all really great suggestions. I think that it is time for us to shift to our presenters, and I think Eric might be introducing them.
Yes, thank you all so much.
Hello, everyone. I'm too busy watching the chat and trying to type in really fast. Thank you, Stephanie, for your sharing. Today, we do have a panel of great presenters who do have some wonderful expertise to share. So be patient with me as I introduce them. They deserve a little bit of time in the spotlight because of all that they do and all that they're going to share today. Our first presenter is Dr. Amy Newmeyer. She's a pediatrician and specifically a developmental pediatrician. So she's a specialist, and particularly a specialist in autism, among other things. She's also chief of developmental and behavioral pediatrics at Nationwide Children's Hospital. She's a parent of a teenage daughter with autism. And she is a longtime colleague of mine and one of the smartest people I know in this field. Our next presenter is Sapna Shetty. I've already had an endorsement from Stephanie about Sapna, but Sapna is a couples and family therapist at the Child Development Center at Nationwide Children's Hospital. As a marriage and family therapist, supervisor, and as a member of our steering committee in behavioral health for diversity and inclusion, she is having significant impacts on both our programming across the hospital, as well as on the next generation of marriage and family therapists, hopefully, that will know a lot more about autism than they otherwise would have. We do have two more presenters, I believe. Dr. Cody Hostetler is a pediatric psychologist at Nationwide Children's Hospital. He has dedicated his career to training primary care clinicians, so the primary care physicians and nurse practitioners and nursing staff that you see when you go to a primary care practice. Training them specifically on behavioral health services and on bringing psychology and behavioral intervention into the medical home. His goal is to improve access to quality care and access to good information about parenting and raising kids with extraordinary circumstances, but doing that in the context of your primary care setting. And I'm also proud to present Dr. Ellen Geib. She's a clinical child psychologist working at the Child Development Center at Nationwide Children's Hospital. Her clinical and research interests include differential diagnosis of autism. She has a focus on language development, and she's also very interested in the environmental and cultural factors on children's development. She has a particular focus and passion for the impact that developmental disabilities have on families. You'll hear Ellen speak to her role of being a sibling of a young person with autism. With that, I'll turn it over to our presenters. Thank you for your attention. And to these 4 presenters, thank you for your expertise.
All right, welcome everybody. This is Cody. We wanted to kick you off today by just acknowledging that if you're feeling tired at this point of the pandemic, if you're feeling like, you know what, I feel like we're 2 years into this, I feel like we'd be further along, or that I'd have this figured out by now, but you're feeling exhausted. That's what we know about pandemics. So we're in what we would call the 4th wave of the pandemic, which is really when kind of the mental toughness comes out of the pandemic. It's the grind. It's the constantly changing. At first it's exciting. At first it's scary. At first it's, you know, everybody into problem solving mode right off the bat. But now it's kind of a grind, and we're getting tired of all the constant changes and trying to keep up with the rules and everything that's going on. So if you are feeling tired right now, just know that we're really moving into this 4th wave of the pandemic, which is where we tend to see quite a bit of the difficulties when it comes to behavior and emotions, not only for kids, but also for parents as well.
Hi, everyone. So this was just kind of some big picture data. This is from the Household Pulse Survey, which was a survey of adults across the United States that's being done by the Centers for Disease Control every few months during the pandemic. So there's a variety of different data points that they're looking at. One of them that they're looking at is rates of anxiety and depression. So again, kind of looking at this across the board, the lighter colors are lower rates of anxiety and the darker colors are higher rates of anxiety. You can see across the United States that over time, during the pandemic, we were seeing the rates of anxiety going higher. We go to the next slide. And then this is very similar rates of depression. So these are both based on for questions that they ask families, 2 are on anxiety and 2 are on depression. So similar changes there as well. So I always like to point out the good news. So the good news is that last summer, as restrictions eased and people were able to get out and about and get back to their usual activities, right, we saw those rates of anxiety and depression go down quite a bit. We do not have data yet for this latest wave of Omicron, although the data period for collection just ended recently. So this data is always online, easy to find if you're interested in looking at that. Can you go to the next page? So what are some possible sources of anxiety and depression, specifically related to the pandemic? You know, for a lot of families, there's less contact with extended family, grandparents, other supports. There's particularly, I know some people are very worried about exposing, you know, older family members, and so less get-togethers than typical. At the same time, also decreasing in extracurricular activities, less access to community supports. For some families, it's been an unsteady job market with kind of the restrictions going up and down over time. Decreased access to therapy services. So we heard that a little bit with our case study today as well. And then of course, virtual schooling, very stressful, but particularly for children that have IEPs and may not be receiving the usual supports that they're receiving in in-person school. Go to the next slide.
So we did a study and asked parents who are coming into primary care across the country. So we looked at 4 different sites across the country, and we said we were trying to determine how much COVID was affecting kids' behavior and their emotional behavior. And we really wanted to know not just whether it was affecting it, but what might be causing that effect. And you guys might not be surprised to hear that the more that COVID stressed their family, things like causing their employment to change, or losing a close family member, or not having access to resources that they used to have to access, the more that COVID affected their family, the more difficulty their child had adjusting. But this is the positive part. I think it wasn't just only that. It was actually, what we found is, no matter how stressful COVID made things, what we really found was it wasn't that COVID caused it. It was that it was a change in the way that parents were parenting their kids that really led to the behavior problems. So it wasn't just stress or COVID causing stress to families. It was when that stress caused families to start using more punishment, spending less positive time with their kids, kind of yelling more, just doing those things that we do when we're parents and we're stressed and we're frustrated. So it wasn't that COVID was directly causing this, that there was something within our control, which was how we're parenting kids. And on the next slide, what we really found is that it wasn't just that COVID led to more negative parenting with kids, like more yelling and timeouts that led to behavior problems, but we also found that kids who were struggling with a lot of stress prior to the pandemic, kids who were feeling overwhelmed, or parents who were feeling overwhelmed to the pandemic, kids who were overwhelmed prior to the pandemic, parents who went through a lot of stress when they were kids, those were the families that were most likely to have that switch to negative parenting once COVID started putting pressure on them. They're kind of doing everything they could do to keep afloat to begin with. And then when COVID happened, it was too much for them. And they started engaging in more punishments, more yelling with their kids, which resulted in more behavior problems. And I think the good news about this is there is part of that we can control. It's not just that COVID causes problems in our children, but it's really up to our parenting and making sure that we're staying attentive to the way that we're parenting our kids that can really help us rethink and help our kids struggle through this pandemic in a successful way, and to maybe even grow from the pandemic. We heard from a lot of families within our study that that sometimes they found moments of growth, that they were able to spend more time during lockdown with their kids, or they learned new things about their kids that they didn't know before.
Cody, we're just rebooting the slides. They'll be right up in just a minute, okay?
Mm-hmm.
Cody, in the chat, there's a few mentions of just additional stressors that our families hear, or families that are in people's circles have experienced too: unemployment, homelessness, financial loss. So I know this is something that we're speaking to very personally too with a lot of families.
Absolutely. And all things that kind of affect us. You know, we try to stay strong for our kids, but when we're going through all this stress, sometimes it can affect the way that we parent, even when we don't even realize it.
So as we keep going here, I see they're popping up. You know, we've talked about how COVID has impacted families across a lot of levels. Routines, you can go back one slide. Different routines, physical and mental health. And what we know is that when an impact is reaching a family or a child or an individual, it's going to go through lots of different levels that the child experiences. And it's given us a special focus on the family as well. We've now been able, with our research now in 2021, to see how that has impacted the child on an individual level. Specifically, we can look at impacts within a cohort or a group of children who have really grown up during the pandemic. So I was looking at two different studies recently that is documenting some of the delays now in preschool children compared to another group of preschool children a few years prior to the pandemic. One study by Dione in a cohort, so a group of kids, found lower verbal scores, motor scores, cognitive scores using standardized developmental testing. And then another study found an increase in behaviors, whether that is more internal inside or external outside, like aggression or disruptive behaviors as well, in a group of kids really who've lived more of their life during these pandemic times than before. You can go to the next slide. We know, even before this study in the 1950s, even before, just in our collective conventional wisdom, that families are really important and serve as a protector against a lot of stress in everyday life. Some of those reasons sometimes lead to just the practical ways that we can organize our lives together, opportunities for communication within families, like talking about emotions or problem solving together, or the chance to grow in terms of how a family might have particular values they want to live out or how they view the world, and then how you grow together as you incorporate new experiences according to those values. The family can serve to really provide that structure. You can go to the next slide. So an article by a few psychologists and the American Psychologist shared that really the well-being of the family in general can protect against stressors on the individual level, so for the child level. And this study was really looking at how a family is coping and identifying how to interpret some of these different stresses within a very stressful event like the pandemic. So factors included, well, how you look at that stressor. The positive coping style that's informed by cognitive behavior therapy tends to look at stressors as something that is just within this particular time. It's not going to last forever. This is something that we can manage. And then an effort to not look at things with a catastrophic thinking pattern that can impact a more positive outlook in how we are looking at stressors like COVID-19. You can go to the next slide. I think Dr. Neumeier is going to summarize this up if I'm not mistaken.
I can take it.
Okay.
So, it's okay. So what we know is like when we think about all of this, and I think so many people know this, there's already been so many great comments in the chat kind of describing the multiple ways that we've seen people, or maybe even been affected directly by the pandemic. Kind of the summary of things that that we know that affect families during this pandemic is just when we've had prior stress and trauma as a family, the pandemic can be harder to navigate. How much COVID has actually impacted our family directly also makes a big difference in how we're adjusting to the pandemic. Also, how much that impact has resulted in us kind of just being frustrated. I love the comment in the chat from Deb about picking battles, winning the battles we pick, but just picking the battles that we have, focusing on kind of building those positive environments, positive relationships, and not getting too caught up into arguments around small things. That's a really important thing that we can do during the pandemic. And the most important thing that we find over and over when it comes to pandemics, when it comes to hurricanes, when it comes to natural disasters and living through war, is that caregiver emotional health is one of the best predictors that we can find for kids coping, which means that sometimes we need to prioritize our own mental health and taking care of ourselves and reaching out for support so we can best take care of our kids. And it's also important that when we're struggling as parents, that our kids are kind of actively coping, meaning that they're reaching out and doing things and finding connections and finding fun things to do during the activity instead of just kind of checking out. That seems to be the best predictor, is getting caregiver support, caregiver mental health, and making sure that kids are actively coping, that they're trying to find ways to engage in this new world that we're living in.
One of the takeaways that that we've been looking at is how families incorporate different routines into their lives. So routines really create organization and predictability. And some things, well, we have to do just to get through our day. There can be just some natural transitions when you're thinking about, okay, nap time, school time, meal time. We also know that transitions can also be difficult. So this gives us a lot to talk about as we support families throughout their day. But routines are really important when we think about what does a day look like, especially when so many other things are uncertain. You can go to the next slide. So this was a study recently in 2020 that was looking at the daily rhythms of families and how they were impacted by COVID. And a qualitative study means that they're talking and interviewing families and then looking for some different themes that each of them starts to talk about. And there were 3 different areas that the authors talked about. We know that routines were just impacted in general during COVID, whether that's now families are working from home, now we have a different school routine. It also might mean there is no more going out to the bus stop or a different parent who is stuck in traffic. There's different opportunities for connection and building meaningful experiences, often in in creative ways. So virtual graduations or birthday parties, or one family started talking about writing letters to build connections with family members. Sometimes these routines gave families new opportunities for daily routines that could really happen together with time to involve their kids as well. You can go to the next slide. What recent research is now looking at is that COVID stress was reduced when families were participating in a lot of these meaningful routines in their daily life. And so this recent study in 2020 found a link that when families were sticking with a particular routine within that family system, they then reported a decrease in some of those externalizing, so outward or internalizing, like depressive behaviors, in a way that routines may have really supported and protected those children and those families. The authors are looking at why, what's the rationale? And they hypothesize that through the parents' mental health, but perhaps also just time and attention to build up family cohesion and parenting was really supportive for these children. I really like this last study by Bates because when you think about the whole day, okay, what are the 3 takeaways? And so within that study, the ones that had the biggest bang for your buck were 3 different routines: bedtime routines, family meal times, and then making sure that there is a limit on any screen time. And so as I read through that, I thought about, okay, there's 3 different areas, you know, maybe not all 3 of them. That sounds pretty overwhelming, would be a lot to start with. But if there's one that, like one you could take a next step on, I'd encourage you to think about maybe a day to increase, okay, we're going to build up that family mealtime routine, like a family pizza night, a Sunday family dinner. There's something to be said about picking one day during the week to start that. Or one less time where screens are on. Or if you want to look at bedtime and then think about, well, maybe we'll just plan on one day we would concentrate on the bedtime routine. It might not be Friday night, but maybe it would be like a Wednesday night thing where we know that we're all here, we're all together, and it would make sense to add another part of that routine that we could all have all hands on deck. And so I'd encourage you to think about each of these 3 rhythms in your life. You can go to the next slide.
So I think some of the lessons learned through this pandemic is that, you know, responding to the pandemic is like responding to a lot of big life events, whether it be a big change in our family, a loss, experiencing a natural disaster, going through a war. What we find is that big problems don't always require big solutions, that sometimes it's about focusing on the basics like sleep routines and meal times and pizza parties and scheduling fun activities and playing some board games that can honestly have the biggest impact on kids. So one of the things that we'd like to think about and acknowledge is just the burnout that we feel as caregivers, you know, and differentiating that from exhaustion, because they're 2 different things. And I think sometimes that we talk about them as if they're the same thing, but they really require 2 very different solutions. So exhaustion, as you can see here, family was having a lot of fun with all those toys, but they're just exhausted, they're passing out, the kids ready to go, and the family just can't do it anymore, right? They're tired, they're exhausted, they're having fun, but there's just too much to do every day and they're feeling exhausted. Burnout feels very different. It does include exhaustion, but it also feels like feelings of hopelessness, things aren't getting better, finding like things aren't very fun anymore, finding like no matter what I try, I'm not feeling effective in what I'm doing, and that can be really difficult. So when we think about different solutions, things like getting some sleep, getting some time away, eating a good meal, some mindfulness or meditation activities, taking a long shower or bath, all of those things can really help with exhaustion. But oftentimes we talk about those solutions for burnout, and those don't work as well for burnout. You know, sometimes when we step away, we just dread going back when we're burnt out. Versus exhaustion, we step away, we get recharged, and we're looking forward to getting back. For burnout, sometimes we really have to understand what's underlying this burnout. What don't I feel effective doing? And what can I control in this environment? For example, in the slides we talked about earlier, we might not be able to control how COVID has affected our family, but maybe we can control the activities we do with our kids during this time. developing new routines. We might need to do things differently than we did before in order to break our burnout. We might need to tear things down and rebuild our daily routines. It's not just about stepping away for a couple hours. It's not about taking a couple deep breaths. It's about really restructuring the way that we do things, identifying really important supports to us, our family supports, our school supports, our medical supports and psychology supports and therapy supports, to really help with this burnout and to let them know that we're feeling burnt out and we need more than just a rest. And then also things like therapy can be really helpful to break these things down and to help us understand, because when you're feeling burnt out, sometimes it takes a lot of extra work to be able to fight that burnout. And we need somebody who can kind of help us see clearly through some of the difficulties that we're going through, because it's hard to sometimes identify the solutions while we're feeling burnt out.
So hi everyone, this is Sapna. So as we've been discussing, forced and unexpected changes have come upon us with the pandemic. Environmental forces outside the system influence the family, but these factors do not determine or control how we as individuals and families respond to them. So some of these changes have led to positive experiences. However, these changes have also created difficult and challenging experiences and times as well. Families typically seek stability in times of environmental change. How well the system adjusts to internal and external demands is important to the health of the entire family system. So sort of as Cody was describing, if the family pushes and tries to keep a routine that may not be working during a time of change, that will cause stress. However, if there is flexibility making changes to fit the new normal, there'll be a decrease of chaos. So just thinking about my own family, in my family, our usual evening routine is having dinner at 6. However, with changes in schedules with the pandemic, this hasn't been feasible. If we had pushed to stick to the schedule, we would have caused frustration and stress within the family. However, changing dinner to a later time has allowed us to adjust better. So when we're looking at relationships, our own individual well-being also depends on the well-being of others in a lot of ways. With new stressors and significant changes, there may be increases of conflict within relationships between couples, co-parents, and also between the parent and child relationship. And the funny thing about relationships is that when we feel unsettled, when we feel uncertain, anxious, irritable, or depressed, we're likely to take that out to the people that are closest to us, the people that we love the most, our partners, our friends, and our children. The loss of community relationships is so significant as we're in the midst of the pandemic as well. We've had to pull away from natural supports outside of our family, such as friends, extended family, and activities and self-care opportunities, such as maybe using the gym. This makes it even more harder to stay positive. Couple boundaries are impacted, the risk of feeling lonely and suffocated at the same time. And then how well children adapt, and factors that influence emotional impact on children are how caregivers respond and the relationship and communication amongst family members. And we can move on to the next slide. So when looking at the relationship within the family system, the quality of each relationship within the family can create either a strong or a struggling family unit. Accessing supports to work on challenging dynamics can benefit the entire family system. So I often tell the families that I work with that I can provide family therapy even with just one parent or caregiver present. There may be a child or even an adult presenting with a problem behavior, but if we were to look at it systemically, we would be perceiving that person as carrying the symptoms for the entire family. So I often tell my families that it really isn't about fixing a specific problem, but it's about how do we heal the family system. So what is family therapy? As a couples and family therapist, that's a lot of what I do at the clinic. It's a form of therapy that provides supports for the entire family system. It can be especially helpful when a family as a whole or an individual within the family is going through a trying or challenging time. So what can it look like? It can look many different ways depending on what fits the family's needs. A lot of times I'm typically working with the caregivers within the family unit. Sometimes it might be just one parent, and other times it might be 2 or more caregivers or parents. The entire family does not need to be in each session. Even just having one member of the family making changes and interactions can create positive changes within the family dynamic. Families can come in for sessions once a week, once every other week, once a month, and sometimes even every couple of months. So doing family therapy in parallel to your child receiving individual behavioral or developmental therapies can be a great way to use this service as it provides supports for the entire family system. So how do you advocate for family support? It can be really important to share your family struggle with your child's primary provider, using phrases such as, my family's feeling overwhelmed with my child's diagnosis. What do we do? Or how do I help my other children understand what's going on? You can also say, my family's struggling. How do I find help for all of us? Or even, managing my child's symptoms is impacting my marriage and my relationship with my other children. How do I manage this? So sharing these concerns with your child's primary caregiver then creates space for conversation. Your child's provider and his or her team can then help your family link with the right types of providers and supports. And then, as Cody, Ellen, and Amy were indicating, I think it's really important to highlight the importance of self-care. Taking care of yourself allows you to be the best of you. Taking care of yourself contributes hugely in you being able to take care of your family and your loved ones. And it's also really good role modeling for the rest of your family. So self-care can look different for all of us. Some ideas that come to my mind are insights, trying a new activity or hobby, something that you might not have tried before, or even going back to a hobby that you did once previously. Physical activities can be a great mode of self-care, such as meditation or exercise, and allowing yourself to get distracted, taking breaks from meetings, getting some fresh air, sitting out on your patio, opening the windows, or even going for a walk. And then limiting your exposure and taking breaks from news and social media can really help as well. And then I'm going to pass it to Sabrina.
Hi, everyone. So just a quick little thing about what's been going on. So a lot of times what we've seen in our clinic is that parents are coming in, they've been waiting until after COVID to evaluate for autism, or until their children can be vaccinated. Parents have held off on daycares and social activities because of this. We're seeing what I've termed COVID babies, who were born right before or during the pandemic, who have had limited social opportunities. But I think the important takeaway is that we should still take a step forward. So it can still be helpful to start the evaluation process, knowing that clinics will also have wait times, and but we'll be able to provide additional action steps or ideas to increase social interactions, and reach out to people that you trust, your doctors, your therapists, early intervention, for additional support.
All right, hi everybody, it's Amy. I'm just going to talk about a few other things, and I really want to go back to the concept that, to address burnout. I think Cody made such a great point on, to address burnout. One of the things you do is try to do something that's really fulfilling, right? That sort of, it's more of an action step. So one of the things that we've done in our family is, we've really looked at community participation, and we found a passion and an interest that was something that we really liked, and it really led us into getting more involved in our local community. The thing that's nice about that is that it really expands your knowledge about the people that are in that community, and then the opportunities to get more involved. We always bring Henry along with us when we do these kinds of things. So we've also found that, by being more involved, we've also been able to do a little bit of education with people who didn't have a lot of information about autism, so that we could, again, broaden our community scope and knowledge about autism, and incorporate Henry into that, as well as do something that, we as a family could do together. So I think it's something for you to think about. Go to the next slide. And some of the ways that you can do this are really simple. Is, look for local events. If there's a festival coming up or a farmer's market, and you can be a patron and go to those things, or volunteer your time to maybe help support them. I know we do that with the arts a lot of times. But I think also just shopping locally and dining locally, so you get to know your community a little bit more. They get to know your family. We've done that with Henry, so they get to know Henry as well. Another one's organize an event. I'll give you a really great idea. There's a family here in town that actually schedules twice a month to pick up food at a local restaurant, and then they deliver it to 10 people. That's all they'll do, is 10 people. And it's typically people that they sort of know in their community. And then they go pick it up, and then their son, who has autism, goes along for the ride. So it gets him out of the house. He's doing a good thing. He's picking up the food that has been ordered at this restaurant. They put together really cute bags. They staple them and have a really note that says, thanks for supporting him. And it's kind of like, a volunteer job, but he's doing a really good service, and it just gets them out, and it's kind of taken us out of like living in this, smaller world. So I think these are some great things that you can do. And again, ways to get engaged and find those fulfilling moments. Next slide. All right, I think we're into questions, and we have a few minutes for questions, and then we'll get into the poll question after this. If you have a question, go ahead and chat them in right now. If there's anything that's in there, let's go ahead and look for those.
Amy, one of the things I might add as people are typing in their questions is just thinking about that item, particularly about bringing things up with your, primary care provider or your child's provider. That can be really difficult because that may not be a question that people are really asking as part of that visit, but kind of thinking about that ahead of time is helpful, writing down some things that you want to talk to them about. But I would also tell people not to be afraid to bring it up, on your own, even if someone's not really asking you that. Because it's obviously a very important thing to all of us, and we know how important mental health is for the children that we see and also for their families. So.
Lauren, it looks like you have a question in there about therapy and cost for caregivers. And Sabrina, it looks like you put a few things in there. Does anyone else have some other suggestions in that area?
Yeah, it looks like Lisa had put some things in there too, but I've worked with a lot of therapists who work on sliding fee scales. And so they'll determine based off of your income what they think you could afford for that.
And I think we'll have some resources as well to look specifically for a family or a couples therapist.
Yes, and always reach out to your Board of Developmental Disabilities. I think someone from Pickaway County said that, but they will sometimes also fund therapy.
I know that you're looking for some groups and things like that in the Philadelphia area. I see that, Jennifer. I think one of the things we can do is we can connect you with the art team to see if we can do some searching in there, and a couple of our hub team members probably have some ideas there as well. All right. All right, so we're going to go ahead and do a couple of questions to you. And Lisa, do you want to go ahead and start those, and Melissa will launch the poll questions here?
Absolutely. Thank you everyone for participating today. Those of you who joined us in the fall may remember that we had been asking you sort of pre and post questions about the content of our talk. Today we're going to try something different. So you should see on your screen a poll that's popped up, which is 4 simple questions. We would love some feedback from you on our Echo today. So please take a look, take just a moment of your time to answer these poll questions. I'll walk you through them as well. The first question says, this family echo session improved my knowledge to care for children with developmental disabilities, including autism. So it looks like we're getting some strongly agreed and neutral responses. That's great. Keep on responding to those of you who have jumped in. If you scroll down in your poll box, you'll see the second question there that asks you to respond to whether or not you learned some best practices for parents or caregivers with children with developmental disabilities, including autism, by participating in today's session. So hopefully you learned at least a few things that are important for you as parents or caregivers to incorporate into your lives in order to better support your child. And if you scroll down again, you'll see our third question here. This family echo session provided ideas that I will use with my own child or in my own practice or life. Again, hopefully you've heard at least 1 or 2 things or more from our wonderful presenters today that you think might be applicable to your group. I know at the beginning of our chat, lots of us were sort of feeling the information that our team presented very viscerally, right? We've all lived this pandemic the last 2 years and understand the challenges. But as we move to the end of that presentation, we had a chance to hear some real gems from our presenters. So hopefully you had some takeaways. And our final question, if you scroll down to the bottom of the poll box, you'll see the case vignette provided meaningful discussion. So many of you participated. We thank you all who chimed in with wonderful questions and recommendations. You all are really a strong base of knowledge. And I think this kind of conversation, being able to share our thoughts and recommendations with each other is really, really powerful. It looks like we have just about 84, 85 participants in our poll so far, but we've got more than 100 of you out there. So if you haven't yet had a chance to fill out those 4 quick poll questions, we'd love it if you offered us some feedback. If you have other suggestions or feedback, please go ahead and feel free to send us that information as well. I know several of you in the chat commented on topics that you'd love to hear about. A few that are coming up are related to transitions and also managing challenging behaviors. So stay tuned. If you didn't get exactly what you needed in today's Family Echo, hopefully some of those topics will meet your needs as well. We'll give you just a little bit more time. It looks like we're getting close to 100. I think we can break 100 here.
I think it's a great goal. Come on, everybody, let's break 100.
Let's do it. We're so close, just 5 away.
And again, like Lisa said, like the more information you can give us in this series, the more it helps us to really shape and design it so that, you know, we're really meeting the needs and covering topics and offering suggestions and ideas and resources that you're looking for. So please feel free to do that. And then again, use the link to offer more suggestions to us. We're always open to that. And it's actually helped to shape our session. Like Lisa said, our next session's on transition because you wanted it and we're going to make it happen. So your voice is really powerful.
And if you missed that link, just scroll back up in your chat. Nancy just sent that in. I know our chat is really busy today, so just scroll back up a couple of comments. You'll see from Support Nancy, a link to a REDCap survey that you can fill out to send us more suggestions.
All right, Lisa, I don't think we're going to get to 100. We're at 97.
Oh, maybe we'll get there. We're so close. 98. You guys are great. We really appreciate you taking some time to answer these poll questions for us. I know it's not why you came here, but it is very helpful in allowing us to continue to do what we've been doing.
Excellent. All right. Well, thank you everybody for completing this. It really, again, it's really helpful. And I think we can move on to Andrew.
Thank you, everybody. So just want to remind and share that the art team is here for you. If you need to reach us via phone, email, chat as well on our website, please do. We've been talking with many of you today directly with your questions. Those have been fantastic. So please, if you want to follow up with us with more questions, reach out to us by phone, email, or chat. And for those of you Spanish speakers, we do have a dedicated line there too. We're looking forward to hearing from you and hope we can provide some resources to help. Thanks so much.
Andrew, thank you so much. It's great to have your team a part of all of this. Like we said at the beginning, we do record these sessions, so you will receive an email in a couple of days. It usually takes us about 48 hours to pull everything together, but it'll have a list of resources in there. It'll have also it'll have the link to the session, and then it'll also have the link to the recording, I'm sorry, and then information about the next session. So look for that to come. And then you'll also receive a certificate for this. If you don't get the certificate, just always reach back out to us. We're happy to help and get you connected to that. All right. And again, our next session is going to be on transition to adulthood. Lisa will be very much leading that session. We're excited for that. And then in March, we're going to do 2 back-to-back sessions on irritability and challenging behavior. The first session is going to really be presented by Eric Butter, and he's going to do it from like the behavior management perspective. And then the March 23rd session will be by our med team, and they're going to be talking about the medication aspect of managing challenging behaviors. And we're going to blend the 2 of them so that you get to hear both sides of that and, you know, understand the best way to collect information and document and then find the best pathway for your child. So I hope you'll join us with that. So in that, it's great to see all of you. Thank you for coming to the session. We'll try to answer any more questions that are in here. And again, look for that link and you can watch the recording back and learn some more. Have a great evening, everybody. Thank you.
Bye, everyone.